What if everything you thought you knew about diarrhea was wrong? That's right. Today we're diving into a topic that might not be the most glamorous, but is incredibly important to understand: diarrhea. There are a lot of misconceptions about diarrhea that we've all probably heard at some point or another, but let's start with one of the biggest ones: that diarrhea isn't a serious health concern. This couldn't be further from the truth. Diarrhea is far more than just an uncomfortable inconvenience. In fact, it can be a symptom of a number of serious health conditions, including food allergies, irritable bowel syndrome, and even certain types of cancer. It's also one of the leading causes of death in children under 5 worldwide, so it's definitely not something to be taken lightly. Another common myth is that diarrhea is always caused by eating spoiled food. While food poisoning can certainly lead to diarrhea, it's not the only culprit. Infections, stress, certain medications, and digestive disorders can all trigger it. Even something as simple as a change in diet can cause it. So it's not as straightforward as just avoiding the buffet at that questionable restaurant down the street. And then there's the myth that all diarrhea is the same. But just like snowflakes, no two bouts of diarrhea are exactly alike. The frequency, consistency, and accompanying symptoms can vary widely depending on the underlying cause, and understanding these differences can be key to figuring out what's triggering your symptoms and how to treat them. Remember, knowledge is power. The more we understand about diarrhea, the better equipped we are to manage it and seek appropriate treatment when necessary. So let's dispel these myths and start taking diarrhea seriously. It's not just about comfort, it's about health. Diarrhea is more than just an inconvenience, it's a health condition that deserves our attention. After all, our well-being is worth far more than any awkwardness a conversation about bowel movements might bring. So, what exactly causes diarrhea? You might be surprised to learn that it's not always that questionable sushi roll or undercooked chicken. Diarrhea can be the result of many factors, some of which are not as obvious as you might think. Firstly, let's talk about infections. These can be bacterial, viral, or parasitic. Ever heard of traveler's diarrhea? That's usually caused by consuming contaminated food or water, often in a foreign country where your body isn't used to the local microbes. And yes, that can include that sushi roll, but also a simple glass of tap water in a different region. Then, there are viral infections like rotavirus or norovirus, which are notorious for causing outbreaks of diarrhea, especially in close-knit environments like schools or cruise ships. Parasitic infections, on the other hand, are often contracted through contaminated water and can cause severe and prolonged bouts of diarrhea. Now let's talk about medications. Certain drugs can disrupt the balance of your gut flora, leading to diarrhea. Antibiotics are a common culprit. They're designed to kill harmful bacteria, but they can also wipe out some of the beneficial bacteria in your gut, leading to an imbalance that results in diarrhea. Other medications, such as antacids containing magnesium, can also cause diarrhea. Next up, chronic diseases. Conditions like irritable bowel syndrome, inflammatory bowel disease, celiac disease, and Crohn's disease can all cause chronic diarrhea. These conditions involve inflammation and disruption of the normal functioning of the gut, leading to frequent, often urgent bowel movements. For people with these conditions, diarrhea is a common and often frustrating symptom. Food intolerances and allergies can also lead to diarrhea. For instance, people with lactose intolerance lack the enzyme needed to digest lactose, a sugar found in milk and dairy products. When undigested lactose gets to the colon, it can cause diarrhea. Similarly, people with celiac disease can't process gluten, a protein found in wheat, rye, and barley. Consuming gluten can damage their intestines and cause diarrhea, among other symptoms. Lastly, let's not forget about stress. Yes, you heard right. Stress can actually cause diarrhea. When you're stressed, your body goes into fight or flight mode. This can speed up or slow down your digestion, leading to diarrhea or constipation. As you can see, diarrhea can be caused by a variety of things, not just food poisoning. Understanding the causes can help you better manage and prevent this uncomfortable condition. So the next time you experience a bout of diarrhea, remember, it's not always about what you ate, but could be related to a whole host of other factors. Now that we know what causes diarrhea, how can we recognize it? It's a great question, and one that we're going to address right here and now. The most telltale symptom of diarrhea is loose or watery stools. This is the hallmark of the condition, and it's often the first sign that something may be amiss. You might notice that your bowel movements are not as solid as they usually are, or that they're coming more frequently. In some cases, you might even feel an urgent need to go, which can be both uncomfortable and inconvenient. But loose stools aren't the only symptom of diarrhea. Many people also experience abdominal cramps or discomfort. This can range from a mild nagging ache to sharp, severe pains. It's your body's way of telling you that it's working overtime to get rid of something it doesn't want. Another common symptom is fever. When your body is fighting off an infection or illness, it often raises its internal temperature as a defense mechanism. So, if you're feeling unusually warm or if you're sweating more than usual, it could be a sign that your body is dealing with diarrhea. You may also notice a loss of appetite. When your digestive system is upset, it's not uncommon to feel less hungry than usual. This can be accompanied by nausea or even vomiting in more severe cases. It's also worth noting that some people may experience additional symptoms such as fatigue, bloating, or even blood in the stool. These symptoms can be indicative of a more serious condition, and you should seek medical attention immediately if you notice any of them. Remember, everyone experiences diarrhea differently. These are just some of the most common symptoms. It's important to listen to your body and seek help if you need it. After all, your health is your most valuable asset, and taking care of it should always be your top priority. You're feeling the symptoms, now what? How do you treat diarrhea? The first thing you need to know is that diarrhea is not a disease, but a symptom. It's your body's way of telling you that something's not right. So, treating diarrhea isn't just about stopping the symptom, but addressing the underlying issue. Let's start with hydration. Diarrhea can cause your body to lose fluids and electrolytes at a rapid pace, which can lead to dehydration. It's important to replenish these lost fluids and electrolytes. For adults, clear broths, water, and sports drinks can help. For children, oral rehydration solutions like Pedialyte can be beneficial. Now, what about over-the-counter medications? These can be useful for temporary relief, but they're not a cure. Medications like Imodium can slow down your digestive system, giving your body more time to absorb water and solidify stool. However, they should be used sparingly and only when absolutely necessary. Remember, diarrhea is your body's way of getting rid of something harmful, and you don't want to interfere with that process unless you have to. However, not all diarrhea requires medical treatment. In some cases, it can resolve on its own within a few days. But there are times when you should definitely seek medical attention. If your diarrhea lasts more than 3 days, if you see blood in your stool, if you have a high fever, or if you're unable to keep liquids down, it's time to call a doctor. These could be signs of a more serious condition that needs medical intervention. Also, if you've recently traveled to a foreign country or have been exposed to someone with a communicable disease, you should let your doctor know. Certain bacteria, parasites, and viruses can cause diarrhea, and these may require specific treatments. If you have a chronic condition like irritable bowel syndrome or Crohn's disease, managing diarrhea can be a bit more complex. You'll likely need to work closely with your doctor to develop a treatment plan that addresses your specific needs. And finally, if you're elderly or have a weakened immune system, be sure to seek medical attention right away if you experience diarrhea. These groups are at higher risk for complications, and early treatment can make a big difference. In conclusion, treating diarrhea is all about understanding the cause, staying hydrated, using over-the-counter medications wisely, and knowing when to seek medical help. Diarrhea can be uncomfortable and inconvenient, but with the right approach, you can manage it effectively and get back to your normal routine as soon as possible. When it comes to treating diarrhea, the most important thing is to listen to your body and seek medical attention if needed. Prevention is better than cure, but can you prevent diarrhea? Indeed, you can. The key to preventing diarrhea lies primarily in maintaining proper hygiene and observing food safety measures. Let's delve into these preventive strategies a bit further. Firstly, it's crucial to remember that cleanliness is paramount. Washing your hands frequently and thoroughly, especially before meals and after using the restroom, is a simple yet effective way to keep harmful bacteria at bay. It's not just about a quick rinse under the tap, though. You need to scrub your hands with soap for at least 20 seconds to get rid of any lurking germs. Next up, let's talk about food safety. It's important to ensure that your food is properly cooked and stored. Undercooked food, particularly meat and eggs, can harbor harmful bacteria that lead to diarrhea. Likewise, food left out at room temperature for too long can become a breeding ground for bacteria. So, make sure to store leftovers in the refrigerator promptly. Drinking clean, safe water is another vital preventive measure. In many parts of the world, diarrhea is often caused by contaminated water. Therefore, it's advisable to drink only purified or boiled water, especially when traveling to places where water quality may be questionable. On a similar note, be mindful of what you eat when you're out and about. Street food, while often delicious and tempting, can sometimes be risky due to questionable hygiene standards. Lastly, if you're traveling to a region where certain diseases that cause diarrhea are prevalent, consider getting vaccinated. Vaccines for diseases like cholera and rotavirus can significantly reduce your risk of getting diarrhea. Remember, it's not about living in fear of diarrhea, but about taking sensible precautions to protect your health. With a little mindfulness and care, you can easily incorporate these preventive measures into your daily routine. By taking these simple steps, you can reduce your risk of experiencing diarrhea. Trust me, your gut will thank you. We've learned a lot about diarrhea today. From debunking long-standing myths to understanding its real causes, recognizing symptoms, and learning about treatment and prevention strategies, we've covered a lot of ground. Let's take a moment to recap what we've learned. Remember those myths we debunked in the beginning? Yes, diarrhea is more than just an inconvenient nuisance. It's a common health concern that impacts millions worldwide. It's not caused by bad luck or a curse, as some myths suggest. It's often the result of what we eat, drink, or come into contact with, and it's a way for our bodies to try to rid itself of something harmful. When it comes to the causes, we now know that diarrhea can be triggered by a multitude of factors. These include infections from viruses, bacteria, or parasites, certain medications, food intolerances or allergies, and diseases that affect the stomach, small intestine, or colon. Recognizing the symptoms is the next step towards managing this condition. Apart from frequent loose or watery stools, other symptoms can include abdominal cramps, bloating, nausea, or an urgent need to have a bowel movement. In severe cases, it can also lead to dehydration, which is a serious health risk. And of course, we've discussed various treatment options. While the majority of diarrhea cases resolve on their own within a few days, there are times when medical intervention is needed. This could be in the form of over-the-counter medications, antibiotics for bacterial infections, or even hospitalization for severe dehydration. Prevention is always better than cure. We learned about the importance of good hygiene practices, such as washing hands regularly and thoroughly, especially before meals and after using the toilet. We also learned about being cautious with what we eat and drink, particularly when traveling. Remember, knowledge is power. The more we understand about diarrhea, the better we can manage and prevent it. So, let's use what we've learned today to take better care of our health and well-being.